Linda St. Louis, the Director of Public Citizens Medicare for All campaign. I'm really proud to work alongside all of the amazing organizations that make up our Medicare for All Resolutions Coalition effort. As we come together tonight, we know that the pandemic has illuminated the worst aspects of our for-profit healthcare system and the systemic racism that's baked into it. By this time today, I just checked, and we have now reached the grisly milestone of 150,000 deaths due to COVID in the United States. We know we have more than 4 million people have contracted the virus. More than 50 million people have lost their jobs. Millions are losing their health insurance at the worst possible time. And Black, Indigenous, and people of color are disproportionately getting affected and are disproportionately dying from the virus. It's really can be hard not to despair at this moment, but we as a movement are determined, and we're determined to use this movement, this moment, to push for change. Last month, we had a really important conversation in one of these webinars of how we center racial justice in our Medicare for All organizing. And tonight we're going to deepen some of those conversations, we are also going to celebrate and learn from recent local organizing victories that have happened in the midst of this pandemic. In the past month, activists in towns and counties as diverse as South Bend, Indiana, Peterborough, New Hampshire, La Crosse County, Wisconsin, Kalamazoo County, Michigan, Red Bank, New Jersey, have all won resolutions in support of Medicare for All. Across the country, activists and local officials in red, blue, and purple districts are standing hand in hand to say, if this pandemic doesn't galvanize us into action to transform our healthcare system, what will? So tonight we have an incredible lineup of speakers, starting with the indomitable U.S. Representative Katie Porter of California, who's been a leader in Congress, holding administration officials and corporate CEOs' feet to the fire since she's been in Washington. And she's one of our powerful champions of Medicare for All, so we're thrilled to hear from her. We'll also hear from 2 city council members to give their local perspective on the pandemic and the need for Medicare for All, and local activist leaders from Wisconsin, New Hampshire, and Indiana who have successfully organized those victories, and from an expert on racial justice or racial disparities in hospital funding. So, as always, you can engage in this conversation in the chat, or if you have called in, you can email us at medicareforall@citizen.org. Our panelists will try to answer questions along the way, and if we don't get to your question, we will follow up with you. We hope you'll actively join this campaign in your community if you haven't already, by signing up on our map in the link that Brittany will drop into the chat. And so let's get started. I'm really honored to welcome Congresswoman Katie Porter, who represents California's 45th Congressional District. Her relentless grilling of CDC Director Robert Redfield led to him promising that anyone, regardless of income, could get a free COVID test. And she's just the kind of champion for healthcare justice that we need fighting for us in Washington. Congresswoman, we'd love to hear your insights about what the pandemic has exposed about our for-profit system and how we as activists can support the work you're doing in Congress.
Thank you so much, Melinda, and thank you to everyone on this call for all of your organizing efforts, for lifting up your voices, for championing the kind of healthcare system that we deserve. So I'm really honored to be joining with you. This is going to be a grassroots effort that is going to push Medicare for All forward in our country, and I'm really excited to be part of the conversation this evening. Long before the coronavirus pandemic, there were really serious structural revolutionary changes that we needed to make in our healthcare system to make sure that it actually serves the needs of every American. So I think it's important to remember, even before the pandemic, this was true. For the first time since the passage of the ACA nearly a decade ago, the number of Americans without health insurance was rising, and that was pre-COVID. Now, not only are there millions of Americans suddenly and unexpectedly unemployed, there are also millions of Americans who therefore have lost their insurance and are trying to navigate a confusing and expensive process to get covered. We don't yet know the exact numbers of those that are now uninsured, but one recent poll found that among those who previously had coverage with their employers, 1 in 5 said that they or a spouse or partner are now uninsured. And that number is likely to grow as unemployment continues. And those numbers don't account for the millions of families who are underinsured on plans that are entirely unaffordable or don't cover the care that they need. The number of uninsured Americans has also risen during the pandemic, with millions forced to pay for COBRA coverage that may equal the entire cost of their unemployment check, leaving no money for food, rent, or other necessities. There are a lot of industries nationwide right now that are facing unexpected and unprecedented downturns. And we have working families struggling with additional childcare costs, hours being cut, or losing their jobs. But I want to be clear, big health insurance companies are doing just fine. They remain strong. Thus far, their annual earnings are expected to be on track for insurance industry predictions that were made before the pandemic. And unlike most industries that recently reported enormous losses, health insurance companies continue to see huge profits. As hospitals and other providers have canceled elective and non-urgent procedures, insurance company claims have decreased. Patients are putting off any health care that isn't essential, but their monthly premiums remain the same. Financial reports show the health insurance industry is stronger than ever. Yet still, health insurers are playing games with our health care. I wrote a letter to United Healthcare, the biggest insurer in the country, because I discovered that they were cutting doctors out of their networks if they wouldn't accept huge reimbursement cuts. During normal times, that would be problematic. During a pandemic, it threatens the lives and financial futures of every single one of their enrollees, and I happen to be one of them. Unsurprisingly, United Health's response deflected blame and failed to answer any of the questions that I asked. So I introduced the Patients Before Profits Act, which would prevent an insurance company from cutting provider networks during a public health emergency. But the truth is, this should never have even been necessary. In a world where Medicare for all is the law of the land, it wouldn't be. In a world where our health insurance markets actually function the way they should, none of this would be happening. But that is not the world we live in. And as this manifests itself in every aspect of our healthcare system, it's just the last 2 years, this isn't the only battle I've had to fight against insurers. The biggest one has been about mental health care. The coronavirus pandemic has isolated people in their homes, it's devastated families and communities, and it's traumatizing frontline healthcare providers. But the challenges are only just beginning, and a second pandemic looms on the horizon. Rates of depression and suicide and anxiety are skyrocketing. What are known as deaths of despair could soon follow. And at the center of all that is one fundamental problem. Insurance companies don't want to pay for mental health care, even though they're required to. So they found ways to skirt the coverage. It drives their costs down, but the losses to our communities are incalculable. So even as our laws and our lawmakers continue to insist that behavioral health care is health care, insurers have treated these laws as mere suggestions. They continue to pay providers differently, cover services differently, and move behavioral health providers out of reach. They are skirting, if not outright flaunting, federal law because their patients come second to their shareholders and to their profit motives and margins. Trying to find a behavioral health care provider who's accepting new patients and accepts your insurance is nearly impossible. And if you choose, as you're likely to have to go to an out-of-network provider and bear the staggering out-of-pocket costs, you'll be confronted with an intentionally complex, complicated process of filing monthly claims that may be denied anyway. That is not sustainable. This is not how you deliver mental health care or any kind of health care. So I've introduced the Mental Health Parity Compliance Act and the Strengthening Behavioral Health Parity Act, which would take steps toward making parity a reality for millions of people in need. It's not enough that the law of parity is on the books. We need it actually to be lived in people's real experience when they try to get mental health care. But this is even bigger than any one kind of care or any one particular failure of our system. Every time there's a GoFundMe page to help pay for care, every time someone cuts pills in half to save money, every time a patient chooses not to go to the doctor for fear of a bill they can't pay, we are failing American families. And this doesn't just happen to the lowest income Americans, although the crisis is acute there. The costs of healthcare are out of reach for the vast majority of Americans, not just the bottom tier. Even those with insurance can't afford their premiums, their deductibles, their out-of-pocket maximums, and in some cases, even their copays. So we need to be clear about the reality of our healthcare system. It's broken. We need to tell the truth to the American people because they already know it. They experience it every time someone gets sick or gets hurt, them or one of their loved ones. They know the system is broken. They know that healthcare, even with so-called good insurance, is unaffordable. Care remains inaccessible for millions of Americans. While we have insurers taking advantage of patients, raising premiums, and reducing choices in care, we need change, and we need it now, which is why I wanted to thank each one of you on this call for your incredible grassroots work you are doing. The changes you are making at the local level are so important. We need to educate our friends, our families, our coworkers, our neighbors, those who don't yet understand what Medicare for All is and what it would mean for them. So much of the pushback on the Medicare for All proposal is because folks have heard far more from big insurance companies and special interests than they have from us. They think, because for-profit health insurers tell them, they think that Medicare for All means they'll lose their choices, that they'll lose access to innovative care, when in reality, we know they'll be part of the biggest provider network in America. This pandemic has made it incredibly clear that our current healthcare system is no longer sustainable. It has pushed us to our breaking point, but it has given us a chance to re-educate people on how we can and should do better, both by pushing forward a Medicare for All system and by making a big and sustained investment in public health. So I want to thank you all for the incredible work that you're doing and know how honored I am to be with you in this fight. And we'll keep fighting until the work is done. Thank you so much.
Thank you so much, Congresswoman Porter. We're so grateful for your leadership and for you taking moments out of your busy schedule to join us. We're inspired by you. We will consider us, the foot soldiers behind you. And thank you so much for being here and for keeping up the fight. So now I'm really pleased to welcome Dr. Katie Himmelstein, who's a resident physician at Massachusetts General Hospital in Boston and a member of the National Working Group of White Coats for Black Lives, which is a medical student and physician organization dedicated to promoting racial justice in medicine. She'll report on a paper that she recently co-authored with her sister, Gracie Himmelstein, called Inequality Set in Concrete, Physical Resources Available for Care at Hospitals Serving People of Color and Other U.S. Hospitals. Welcome, Dr. Himmelstein.
Thank you so much, Melinda. I'm really happy to be here. So as Melinda mentioned, I'm here to talk about this paper that I recently co-authored with my sister, Inequality Set in Concrete. And this is a paper looking at the capital differences between hospitals serving Black and Latinx patients as compared to hospitals predominantly serving white patients. This paper grew out of my own experience and my sister's experience in medical training, where it's very obvious as you travel between different hospitals that the hospitals that serve our patients of color have much poorer physical plants. They're much more crowded, they're much more outdated, there often aren't the resources that you need, the technologies that you need to provide care for patients. So this was an observation we made, and then we were hoping to demonstrate this with the existing data. So we The paper basically uses Medicare cost reports to look at the capital, the machinery, buildings, grounds at different hospitals. And I think we're all familiar with the wealth gap, the racial wealth gap in the United States, which, as we know, numerous studies have documented that Black families have about 10% of the wealth of white families in this country. But what our paper shows is that that's not just true on an individual or household level, that's also true on the level of the institutions that serve our Black and Latinx patients. And so, what we found ultimately in our paper was that when we look at the capital resources, hospitals that serve Black patients have about 60 cents for every dollar that a hospital serving white patients has, and hospitals that primarily or disproportionately serve Latinx patients have about 70 cents for every dollar of capital that a white serving hospital has. And this inequality is not getting better. In fact, it's getting worse. What we found when we looked at investment in new capital, so new investments in the material resources of hospitals, was that new investments are also inequitable. So when we look at those, for every dollar invested in new capital in a hospital serving white patients, only about 40 cents are invested in hospitals serving Black patients, and only about 50 cents are invested in hospitals serving Latinx patients. So what we can see, given this inequity in new investment, is that the inequity in existing capital stock is only going to grow. And just for a sense of what that looks like, or sort of like what the order of magnitude we're talking about here, Black and Latinx serving hospitals have about $200,000 less per bed than hospitals that serve white patients. So this is really a staggering inequity in resources. And that translates, we found, into inequity in sort of the materials that doctors, nurses, and others require in order to serve patients. So we looked at 27 capital-intensive services. So by that we mean imaging technologies like CT, MRI, care technologies like radiation therapy for cancer. And we found that out of those 27, Black and Latinx hospitals had access or poorer access to those resources for 19 out of the 27. So that includes, for the healthcare providers on the call, essential resources such as a catheterization lab that would be used to treat a patient coming in with a heart attack. This includes weight loss surgery. So we found really that systematically our Black and Latinx patients are being served by hospitals that don't have the resources they need to have their full spectrum of healthcare needs met. And we sort of, this finding leads us to ask the question of why. And I think that many people on this call can probably imagine that a hospital's access to capital, to investment in resources, is directly linked to its profitability, right? And in the case of nonprofit hospitals, there's sort of revenue excess. We don't call it profit, but it's essentially the same thing. And we know that profitability is linked to the insurance status of the patients that you serve, right? Medicaid reimburses at much lower rates than private insurance, and uninsured patients' care is often not reimbursed at all or reimbursed at very low rates. And we know that disproportionately Black and Latinx folks in our country are uninsured or are insured by Medicaid insurance. And so the hospitals that serve them are less profitable and therefore have less access to capital. So that's sort of our thoughts about where this inequity is coming from. And so when we then turn to the question of what sorts of policies would be helpful for addressing this inequity, certainly Medicare for All would address the sort of differences that we see in insurance and reimbursement for hospitals that serve Black and Latinx patients. I think that one thing that's really important from our findings is to emphasize that it would not merely be enough to sort of equalize payments, right? To say, okay, well now everybody has Medicare for All, the same insurance, all hospitals are going to be, starting now in the year 2022 or whatever it is, reimbursed at the same rate for their care of patients. What's actually required is what I tend to think of as medical reparations, right? We see that Black and Latinx serving hospitals have a deficit of resources, and there needs to be intentional, not race blind, but race conscious investment in the institutions that serve our Black and Latinx patients in order to ensure that they have equitable access to care. So I think that that's sort of one of the major implications of our findings. I just wanted to briefly say, Melinda had also asked that I just share with the folks on the call from my sort of role as a member of White Coats for Black Lives, any insights I might be able to share about how we can center racial justice and a sort of racial justice analysis in our work. And I just had two very brief things to offer that I hope may be helpful. One, I think, is that it can be very helpful. It has been helpful for me to center an understanding or a focus on racial capital, racist capitalism, ultimately in our analysis, and to say that the current arrangement of things, so for example, the fact that Black and Latinx serving hospitals have less capital is not an unhappy accident that just happened to occur, right? This is a system that functions exactly as it was designed to function, which is to channel resources to white, wealthy people and away from poor Latinx and Black folks. And I think a very concrete example of that is the fact that we have inequitable insurance. So the fact that we have private insurance, Medicaid insurance, we have folks who are uninsured, is designed as a mechanism for segregation, right? So it is illegal for me as a doctor to say that I do not see Black patients. It is perfectly legal for me as a doctor to say that I refuse to see patients with Medicaid, right? And so insurance status becomes a way of facilitating racist discrimination. So I think that that's just a really important analysis for us to all have. And then the second piece I would offer is just the importance of partnering with local organizations that are led by Black people, Indigenous folks, and other people of color who are doing racial justice work, and both reaching out to them to join whatever other activist work we're doing, but also offering our time and resources to them in service of the work that they're doing. So I just wanted to offer those as some strategies.
I use it too much. We need one of the two parties to care about the people. Some people are more concerned about the language that I use than the fact that people are.
I think maybe.
They're more concerned about being prim and proper instead of focusing on.
Okay, sorry about that. Okay, thank you so much, Dr. Himmelstein. That was excellent. There was a lot of interest in the chat. As you can see, you might want to look and see if there are any questions, but we did make the paper available. Everyone's very interested in that. So thank you so much. As I mentioned earlier, thanks to the tenacity of activists and local elected officials around the country, we've achieved a number of local victories, even in the midst of this pandemic. One of those exciting victories was in South Bend, Indiana, and I'm really excited to welcome Bill Price, who organizes with Our Revolution and Medicare for All Michiana, who participated in the advocacy effort, and who will introduce South Bend City Council member Henry Davis, who championed that resolution. So welcome, Bill and Councilmember Davis.
Thank you, Melinda. That's quite the act to follow, but it's good to be here. My name is Bill Price. I'm a behavior clinician with Northern Indiana Therapies. Noelia Rodriguez from our Revolution, myself, together a Medicare for All resolution form for the South Bend Common Council to consider. We had a major backer in Councilman Henry Davis, who was instrumental in getting the resolution on the agenda for June 22nd. And there's kind of an interesting side note. The president of the council just up and resigned, just quit out of the blue, like a week earlier, effective immediately. So we weren't sure how that affects our resolution to be voted on or debated. But Mr. Davis made sure that we didn't lose our place on the agenda. So he ushered it through without any other problems there. The meeting was held virtually. We had about 5 or 6 callers who spoke on behalf of the resolution. And I just want to emphasize to everyone, you don't have to be a resident of the city that you are speaking on behalf of your resolution. I don't live in South Bend, but my job requires me to make in-person visits to families in South Bend and the surrounding area. The focus of my presentation was just to pass along, personal stories of families that I work with, dealing with medical issues alongside, having a family member who has a mental health issue that, requires continuous medical care. So I shared some stories about, families having to navigate the complex, labyrinth that is our healthcare system. I would recommend to get personal stories and to share those with your council members. The other part of my presentation was just to highlight the current economic conditions in St. Joe County, where South Bend is. We talked about the unemployment rate and referenced a community needs assessment from 2015. That was the most recent. That was the most recent survey that I could find, and it just surveyed everything about the needs of St. Joe County, basically. Mental health, suicide rates, teenage pregnancy, mortality. It just covered everything. But the thing that I stressed was the survey when they asked respondents about what were the 4 top barriers to accessing health care. And number 1 was inability to pay out-of-pocket expenses, co-pays and prescriptions, lack of transportation, inability to navigate the healthcare system, and just lack of health insurance coverage. So I just made the point that a single payer Medicare for All system would address at least 3 of those 4 barriers. Other speakers, highlighted personal stories. Noelia highlighted the racial disparities between or inherent in our healthcare system. The final vote was 7-1. I think the one dissenting vote came from somebody who just didn't feel the council's time should be taken up by passing resolutions that are mostly symbolic. And the other comment that somebody made was that another council person made was that they would not have voted for the resolution were it not for the current pandemic. And that kind of bothered me. I think everybody on this call knows that we needed a single payer system long before the pandemic, and I appreciate the fact that our current situation is opening the eyes of those who didn't believe we had a corrupt system. So but that's kind of, I wish we could just convince people just on the merits without having to add in the current pandemic and our current situation. But whatever helps to get it done is fine. And just finally, I would say that I would recommend to people who are considering resolutions in your area, find a council member who is in your corner, who will work enthusiastically to convince other council members to support the resolution. And our council member or shepherd, if you will, was Henry Davis. Mr. Davis was first elected to the South Bend Common Council in 2007 at the ripe old age of 25. He served 2 terms before running for mayor in 2015. He won his 3rd term in November of last year, and he currently serves the citizens of South Bend 2nd District. So please welcome Councilman Henry Davis.
Thank you, Bill, for the introduction, and hello to everyone. And I'm saying hello to everybody that's listening We had an awesome opportunity to support Medicare for All for a number of reasons, but for the right reason, because it was the right thing to do. So we thought when it came up, the idea is that we get it pushed through the resolution form because it's been done in other cities that call themselves progressive. And so if South Bend wants to be among that number of progressive cities throughout the country, then we should just, follow suit. There's other underlying reasons and issues as well. I've heard, like many of the other speakers before me today, and then even, weeks before, because this has been a constant conversation about Medicare for All and the need for it in proper health care. And I can go into my own personal stories of, my infusions costing. I suffer from multiple sclerosis. And so my for one infusion is like $50,000. And thank God that we have insurance. The thing that we have a problem with is the premium, right? We have to like this really, really high premium out-of-pocket expense. And I heard Katie was talking about that before I got on, about the amount of money that you have to pay in order for the insurance company to start participating at 100% level or at 80-20 level, and it's just really obscene. But thank God that I do have some sort of insurance, but those that don't have it, yes, we have to fend for ourselves, right? So it takes on this racist overtone. I think that this was the other part of the conversation I grabbed onto, that people of color or Black people, mainly brown people, Latino, Latinx, that has been used as well, that people need this type of coverage, obviously, to live. And who doesn't want a healthy community? Who doesn't need healthy workers at their jobs? We have to continue to push the envelope on this idea, this reality that we need something better than what we do have. Our healthcare system, like was said before, is completely broken. It's tanked. And it seems like the people with the big bags, the fat cats, the cartoons that we are accustomed to seeing, the fat cat with the cigar in his mouth, they are interested in just making more money and off of the backs and the lives of the people that need the help the most. Right now, right after that, the St. Joseph County Health Department declared that racism was a public health issue, a crisis that went through our South Bend St. Joseph County Council, which was an awesome idea. So there are some wheels here turning, some lights are coming on, but the thing that I continue to push is policy. We have to have policy implementation. We have to have dollars behind it. We can't miss the opportunity anymore to not be very clear and direct about the needs and services for the people that live in our areas. South Bend right now, we boast over, I think it's like close to a 50% poverty rate within the Black community, double-digit unemployment. We have a number of houses that have been knocked down. We have a homeless crisis going on right now here in South Bend. Many of those people are people of color or Black people. So you're still rehearsing the same conversation, and it's the same people asking the same people, the elected officials, for help, and some of them are either tone deaf or they just don't care, and you still see the same cycle. So what I want to impress upon anyone that's on this call, because we do understand Medicare for All is necessary. We understand that our health is at risk. We understand that it's costing too much money to even get insurance for people that work every day. But the idea is now that we have to really press in on who is our representatives. We have to make sure people are voting, and they're voting with some idea or a good idea why they're voting for that person. We just can't keep going in and thinking that a straight ticket will get us to the promised land. If I remember correctly, didn't the Democrats here recently vote against this particular bill? And it's not even like I guess the idea, not the bill, but the idea, even being a part of Joe Biden's campaign. We have to keep pushing the button. We have to put people in office that are going to do something for us, that are unapologetic about their service to the community and to the people that they represent. If we do not, we'll be back here another 5 years, another 10 years talking about the same thing or something even worse. So anytime that we need to organize and work on something like this, I'm all for it. It was fun. We'll continue to push forward on the idea, but it's something that's necessary. And not only necessary, it's our lives at risk. And the people that live next door to us, lives are at risk. Thank you so much for your time. I appreciate it.
Thank you so much, Councilmember Davis. We're so grateful for your leadership and to have stepped forward at this moment. You know, I think it was also quite, the South Bend victory in particular got a lot of attention and on social media, because importantly, the resolution did not call for Medicare for all who want it, right? It called for Medicare for all, which I think was a really critical point to show that in South Bend and all over the country, we're calling for Medicare for all. So thank you again so much. Last week, we were also thrilled that a resolution passed in Red Bank, New Jersey, in Monmouth County, New Jersey. We are honored to have with us a Red Bank Councilmember Kay Traggiano, who championed this resolution. And thanks to our Revolution Monmouth County that worked with her and others. Councilmember, could you share why you chose to champion this resolution and any insights you have for others who might want to approach their council members to pass a resolution?
Sure. So as Bill was saying in his introduction of Councilman Davis, you know, find a council person that can champion it, or make yourself the council person. That was the case for me. I was an activist involved in the movement. And I'm on my first term, so it's really been an honor to, you know, be able to champion and see this through with my colleagues and my teammates and fellow activists. But first, you know, thank you, Melinda and Public Citizen, for hosting, Congresswoman Katie Porter, Dr. Himmelstein. It was awesome. Sobering and horrifying, but still awesome to learn more and have more factoids for myself to pull out of my brain when I'm trying to explain to people inequities. Those were great numbers for me to share, so I was grateful to hear you speak. South Bend, I'm hearing about South Bend a lot in New Jersey. I mean, that's rare. I just got to say, that tells you something's up. So it's really nice to see you, Councilman Davis, and all local governments who have successfully passed Medicare for All resolutions. I just saw in the chat, Kalamazoo. It's always a fun word to say, Kalamazoo. Congratulations. And I see that on the call, we have a bunch of people from Monmouth County, Boris, Anna Marta, Robin, Morgan. So many of the people that are on the call right now have been working so closely together on this. So I'm grateful to everyone who worked together. July 22nd, so 1 week ago today, our Borough Council here in Red Bank unanimously passed resolution number 20-171. Yes, it's in support of Medicare for All Act of 2019 and specific to the pandemic, the Healthcare Emergency Guarantee Act of 2020. This resolution also has language expressing support for the New Jersey Assembly Bill number 2269, which requires hospitals to include warnings in patient discharge records concerning the risks of addiction and overdose associated with opioid medications. So there is some other local language peppered in, but much of the resolution language we use can be found at medicareforallresolutions.org. The recitals that we found there are fantastic and informative, and it was just such a great starting point for our town to work with and for our revolution to work with us and provide. So really quick, how we got to the point of being the first municipality in New Jersey to pass a Medicare for All resolution. There's been so much organizing in Red Bank. We are an activist hub. We are a blue island in a red sea where we are. We're a diverse 2 square mile town. We are documented, undocumented, Latino, white, Black, the top of the 1% on the river, while we also have 90% of our school children, with my kid in school, on subsidized lunches. So we're a super diverse town. And I can truly say that over the past 4 years, we have been connecting our east side, our west side, the people with resources who want to help, and the people who need their voices amplified. So much of that work really led up to us getting this resolution passed. In 2018, our revolution chose Red Bank as a location for an event, a Medicare for All forum, and that was real education. And that's what we keep talking about, is if you want to organize and win and have one of these resolutions pass, start educating. Get local people together. It could just even be a doctor that's a provider that can talk about the day-to-day. It could be somebody that I worked in billing and checking for a hot minute, and I'm even able to talk about just my personal experience with that. Put a small panel together and invite people, you know, via Zoom, I guess now, to hear what people have to say. So it was great that they chose Red Bank as that starting point in that conversation. And it also really coincided with everything we've been talking about, right? The chessboard's been kind of set on fire. We're dealing with Trump. But one of the silver linings of that is that as we're doing our organizing work in immigrants' rights and in our community, as we're working towards Medicare for all, as we're working on the environment, so many of these groups are starting to come together, and one place that we all intersect is Medicare for all. So that's basically all I can share at this moment. I am just honored to be on this. It's really interesting to see what happens when you go from organizing and then being at the table and then being at the table again. And if I can just take this moment to say to anybody out there listening, please run for office, because this is what happens when we run for office. I'm blessed to have other Democrats, all Democrats, on the council with me, but that does not mean that Medicare for all that resolution would have been introduced. That doesn't mean it would have been unanimous. It doesn't mean it would have gotten there. So you really need to put yourself in that position. And this is me pleading with you to put yourself out there and go for it. So thank you so much. I look forward to hearing from everyone else.
Thank you, Councilmember Traggiano. I'm so glad that you were able to join us. And I'm loving your posters back there. So next, we are very pleased to welcome Ben Wilson with Citizen Action of Wisconsin, an affiliate of our partner People's Action, to tell us about their recent organizing victory, again, one of 5 in July, in La Crosse County, and their next steps for Medicare for All organizing.
Thank you, everybody, for having me. As mentioned, I'm with Citizen Action of Wisconsin. We're an affiliate of People's Action. Citizen Action is a member-led and member-funded issue organizing group. And so when one of our members, Lewis Coleman, came to me with the idea of passing a Medicare for All resolution in La Crosse County, we were thrilled. We were excited. We made sure to give Lewis the resources he needed to actually write up the resolution. He took the lead on this, and he deserves so much credit. He's become a true leader in this. He worked with Medicare for All resolutions and with our healthcare director to write a resolution for the county board. And we had it submitted to the county board by another one of our members, Monica Cruz, who happens to be the county board chair. Monica submitted it to the Health and Human Services Committee on the La Crosse County Board. And they loved the idea, and they added local statistics, both healthcare statistics and economic statistics of how La Crosse County could benefit from a single-payer universal healthcare system. So right off the bat, our members were involved in this, and our members were the ones taking the lead. Our idea, we were very, very intentional about the timing of this. La Crosse County is a smaller county, 115,000 people, and we are represented by Democratic Congressman Ron Kind. Ron Kind is the longest serving congressman in Wisconsin. He's also one of the most moderate Democrats in the House right now. And we wanted to make sure we sent a message before his primary that Medicare for All matters to the people in the purple county of La Crosse, Wisconsin, his home district. So we made sure that this passed the county board before his primary. And we will be working with one of our other chapters in Eau Claire County to pass it, which is also represented by Congressman Kind, to pass it in Eau Claire County before his general election. So he is being sent a strong message on Medicare for All before both of his elections, this election cycle, to let him know that he needs to be a co-sponsor on Medicare for All. Locally in La Crosse County, of the 29 county board supervisors, 27 of them voted for Medicare for All resolution. Moving forward, first of all, we know which 2 county board seats we need to target to turn progressive. We are going to be mobilizing our members to run for office and giving them the tools and the infrastructure to win their races so that we can have a truly progressive county board. We are also, like, as I said, we're going to be moving forward with a resolution in Eau Claire County and in other counties throughout Wisconsin. And that's pretty much all I have. Once the resolution moved out of the Health and Human Services Committee, we had infrastructure in place to start a massive lobbying effort aimed at the council members. As I mentioned, La Crosse County is a smaller county, 115,000 people. Those county board members are not used to getting emails from constituents. They're not used to getting phone calls. On the 10 days before the resolution came on the agenda to when it was voted on, each of those board members received about 100 emails that we helped generate showing support for Medicare for All resolution. We also mobilized, I believe, a half dozen people to speak virtually speak at the board meeting. So yeah, moving forward, we're going to pass this through Eau Claire County, and then we're going to take it to our other citizen action co-ops across the state. Thank you all so much. If we can do it here in purple La Crosse County and small town La Crosse, we can do it anywhere. So thank you all.
Thank you so much, Ben. So next, we're also really happy to hear from another one of those victories from this month, from Dr. Ahmed Kudi, affiliated with Physicians for a National Health Program, who won a resolution in the New Hampshire town meeting in Peterborough. Earlier in the month, residents of Hanover, New Hampshire, which is where Dartmouth is, also voted in favor of a Medicare for All resolution. Dr. Kudi, are you there? Oh, let me unmute you. There we go.
Oh, okay. Hi. Can everybody hear me? Okay.
Loud and clear.
Yeah. So Peterborough is a purple state, a purple city. 55 Democrats, 45 Republican, roughly. So we were not sure how this will go. And because of COVID, the ability to do face-to-face or any type of direct campaigning was limited. And other than I relied on what I'm showing here, this type of street signs, about 10 or so, and I placed them in very busy or visible areas in the streets, and an ad in the paper the weekend before, print ad. But that lady in charge of the paper was very helpful, because I also had a digital component to that ad, which essentially took my script, which was also read by the city staff from the city council as part of my introduction on the resolution, which basically was nonpartisan. She wanted that to be nonpartisan, and it was supposed to appeal across the spectrum politically, and it did. A brief reading, and I think our strategy of appealing to the pocketbook, namely the tax savings, about $1 million the city of Peterborough would save if we were to federalize the expenses of funding healthcare for the city employees. And that didn't even include the city, school district employees. That is the town contributing to the Cornwall School District, which was even, so when that was thrown in, the potential savings would have been 1.2 million, in that range. So, in other words, pocketbook appeal. And then, in addition, we said, for saving that much, we gain healthcare for all Americans. And without using the word universal, all Americans, white, black, brown, and all hues in between, I said. And that statement or introduction on my article was read out by a city staff member as part of on their website. And then on my ad, digital ad, there were 10,000 hits. So I believe that was probably a very helpful, technique to sway the voters, because there was no campaigning in the traditional sense. And then, of course, Brittany's phone banking team did contribute that weekend, Saturday or so. And the vote was on Tuesday. And surprisingly, it's something like nearly 2.5 to 1, 535 or so ayes against 240 nays. And so, but the turnout was small. The overall electorate was supposed to be 5,000. But of the people who cast the votes, we got about roughly 60%, 65% positive. So my take is that American public, this little microcosm of Peterborough voters is ahead of the leadership, not even in the Democratic Party. So the Democrats, so-called moderate Democrats or corporate Democrats, the Biden, Pelosi's, and all, including at the local level, our 4 representatives, two to the Senate and to the House, all 4 have not co-signed or expressed any support for Medicare for all. Whereas public opinion seemed to be 65–70% in favor of moving towards a single payer. So I think our leadership is out of touch or out of tune with the public opinion, even at this point into middle of the pandemic. So I think it is our job to persuade them that they are doing the right thing and they don't need to be afraid of backlash from the other side. And so I think we are at a right moment to keep pushing and never let up. And so that's my message. In other words, it is not a sprint, it's a marathon. But for this election, we had to sprint towards November. Thank you for listening.
Thank you, Dr. Katie. It's been great working with you. And as all of you know, the purpose of these webinars is to inspire us all to take action where we can in our communities. And our awesome summer intern, Aurora, will share some of the tools of how you can get involved.
Hi everyone, good evening. So my name is Ashi and I am a current intern with Public Citizens Medicare for All team. And so I've been active in the Medicare for All movement, beginning with my participation as a leader in the American Medical Student Association, also known as AMSA, which is an important partner in the Medicare for All resolutions campaign. And so this summer I've had the wonderful opportunity to get to know some of you as we've passed several resolutions across the country. Doing this work in the context of a global pandemic and an uprising for racial justice has been eye-opening, and I've been inspired by national and local leaders who are creatively organizing for change. So I want to briefly go over some of the resources that we have made available in our activist toolkit that all of you can access based on the strategies that we've found that other successful activists have used in their communities in order to pass Medicare for All resolutions. And so I'm going to share my screen here we go, share. Okay, I can't really see anyone but I can see. Melinda, can you nod if it is good? Okay, cool. Okay, so this is our main page. So to get here, as you can see, you need Medicare for, the number 4, allresolutions.org. And so this, if you ever are wondering, oh, I want to get back into doing resolutions work, just go to medicareforallresolutions.org. Then you scroll down and here you see COVID-19 resources. And you press learn more. And that is loading. And then if you scroll down, this is where I'm going to focus on, is this last bullet point. And I'm going to highlight it so all of you can read it. And so this is our page for the tools that we think are useful for organizing during COVID-19. We're putting the link in the chat and in the follow-up email that we will be sending you after the webinar. And so right now, one of the best ways to get things moving is to send an email to your council member to ask for a virtual meeting. We found that even the activists who have already tried to work with their city councils before found success again during COVID-19, especially when they make the case that ties the importance of Medicare for All to this current crisis. We do have a template email that you can use to draft an email to your council member, and that is right here. That's the first bullet point. And then we also have an updated timeline right here, the second bullet point. and that's the timeline for passing a resolution during COVID-19. And then we also have some sample resolution language, which is in the third bullet point. And so you can also read some sample resolutions and examples of joint resolutions in support of Medicare for All, as well as the Health Emergency Guarantee Act that we've seen success in cities like New Orleans, Knoxville, and South Bend. And if you haven't already done so, we really urge you to please sign up on our map to be connected with folks in your community. And so for those who are looking to begin this work in your local community, you can find activists in your area or get your own city on our map by signing up through the link that Brittany will be sharing in the chat right now. So be sure to check out that link. And so I just want to say, again, thank you so much for working with me this summer. I look forward to continuing this work through working with AMSA. And as a current medical student and a future doctor, fighting for Medicare for All is extremely crucial for the future of my own profession and for my future patients. And so being trained in how to work within a broken system has really energized me to continue this work to reform the system in a community-driven, local, and anti-racist manner along all of you guys. So thank you so much, and I yield my time. And I'm going to unshare my screen.
Great, thank you so much, Ashi. And I want to thank Ashi so much and our other great summer intern, Reed, who has been working tirelessly, calling many folks, doing a lot of the one-on-one outreach, along with Brittany, and we're so grateful for their help and their continued activism. But before we end, I also would like to turn it over to Dr. Bill Honigman, who is a key partner with Progressive Democrats of America, to give a quick update about their healthcare emergency town halls that PDA has also been hosting, and PDA has been a really critical partner in many of the local resolutions efforts around the country. Dr. Bill.
Thank you so much, Melinda and Brittany. Thank you, Public Citizen. Thanks everyone who's been on the call tonight. Really appreciate hearing from my member of Congress, Katie Porter. I happen to live in her district, and I'm just ecstatic that she has, we have her ear. She is listening to the people of her district and advocating for Medicare for All. So we have had emergency town hall meetings that we're calling PDA Healthcare Emergency Town Hall meetings every Sunday since the lockdown began, and we've featured local leaders like these tremendous council members here, Councilmember Traggiano and Davis. Thank you so much for your advocacy in your position as elected officials, and all the advocates here. We had some big names too, like Ralph Nader, John Nichols of Nation Magazine has come by, but basically it's a relatively intimate discussion group, and we just would love to have everyone join us every Sunday, 4 p.m. Eastern, 1 p.m. Pacific. And this week we're having a candidate for Congress from the Flagstaff, Arizona area, Eva Pusova, and also a county commissioner from Pinellas, Florida, Ken Welch. And once again, y'all are invited. Please check out our Facebook page, PDA Healthcare, for the event details. Thank you so much, everyone.
Thank you, Dr. Bill, and thanks really to everyone who participated in tonight's discussion. Special thanks to Congresswoman Porter, of course, and to Council members Davis and Traggiano for taking the time out of your busy schedules to share your insights with us, to be a part of this fight, and we're here with you. And many thanks to everyone who attended and who participated in the chat. There was a very robust discussion, and really it's all of us that's going to take all of us to do this work. And so I want to thank all of you for continuing to show up, to continuing even in the midst of the slog that we're all in with this pandemic and with all of the injustices that we're having to face. We're really excited about the momentum that continues to grow even during these challenging times, with the recent victories we heard about tonight, as well as others. And we know that many folks around the country are really making great progress in their communities. So we want to support you however we can with our toolkit. We can do one-on-one support. Please be in touch with us of how we can support you in your organizing. And please, please, please sign up on the map. And add your city, add your community. We have more than 340 resolutions efforts happening around the country, which is super exciting, but we need to have hundreds and hundreds to really change the national conversation. And I believe we can really do that. So please be a part of this movement. Please mark your calendar. Our next webinar will be at this same time on Thursday, August 27th. So if you have ideas for upcoming webinars, please let us know. Medicare for All at citizen.org. And we will, or if you'd like to give an update yourself. So we are thrilled to be a part of working with all of you. And again, thank you for this. Thank you for joining us. And please stay safe out there. Take care.